Congratulations! You've reached weeks 35 and 36 of your pregnancy. This is a significant milestone, and you should be proud of how far you've come. Your body has been working tirelessly to support the growth and development of your baby, and now you're in the final stretch. Your baby is the size of a honeydew melon and is busy putting on those final finishing touches. At this stage, your baby is continuing to gain weight, and their skin is becoming smoother. They are also practicing breathing movements, which are essential for their first breath after birth. You are nearing the end of this incredible journey. It's a time filled with anticipation and excitement as you prepare to meet your little one. Take a moment to reflect on the journey you've been on and the changes your body has undergone to bring new life into the world. Your body is working hard to nourish and prepare your baby for life outside the womb. Eating a balanced diet and staying hydrated are more important than ever. Make sure to include plenty of fruits, vegetables, and protein in your meals to support your baby's growth. During these weeks, you might feel a mix of excitement and anticipation. It's a good time to start preparing for your baby's arrival by setting up the nursery and packing your hospital bag. Feeling those baby kicks and movements can be a reassuring sign that everything is progressing well. It's completely normal to feel a range of emotions. You might find yourself laughing one moment and feeling a bit overwhelmed the next. Keeping a journal can be a great way to process your thoughts and feelings during this time. Remember, it's okay to ask for support from your partner, family, or friends. You've been through so much. From the early days of morning sickness to the joy of feeling your baby's first kicks, each moment has brought you closer to meeting your little one. Looking back at photos or keeping a pregnancy journal can help you appreciate how far you've come. Remember, every pregnancy is unique, and there's no one-size-fits-all experience. What you're feeling and experiencing is valid, and it's important to listen to your body. Attending prenatal classes can provide valuable information and support as you prepare for labor and delivery. As you approach your due date, it's important to stay informed about the signs and stages of labor. Understanding what to expect can help you feel more prepared and confident. Don't hesitate to reach out to your healthcare provider with any questions or concerns you may have. Your body will give you signals when it's time. Pay attention to any changes, such as regular contractions, water breaking, or a decrease in fetal movements. Timing your contractions can help you determine when it's time to head to the hospital or birthing center. Take each day as it comes. Practicing relaxation techniques such as deep breathing, meditation, or prenatal yoga can help you stay calm and centered. These practices can also be beneficial during labor, helping you manage pain and stay focused. Rest when you need to. Your body is doing a lot of work, and it's important to give yourself time to relax and recharge. Taking short naps or resting with your feet up can help alleviate some of the discomforts of late pregnancy. Enjoy these last few weeks of bonding with your little one before they make their grand debut. Talk to your baby, play music, and cherish these moments. Soon you'll be holding your baby in your arms, and all the hard work will be worth it. You might have already experienced Braxton Hicks contractions, also known as practice contractions. These contractions are a common occurrence during pregnancy and can start as early as the second trimester, although they are more commonly felt in the third trimester. They are named after the English doctor John Braxton Hicks, who first described them in 1872. These contractions help prepare your cervix for labor. They are essentially your body's way of getting ready for the big day. Think of them as a rehearsal for the real event. While they can be uncomfortable, they are generally not painful. They typically feel like a tightening sensation in your abdomen. This sensation can last anywhere from 30 seconds to 2 minutes. You might notice that they come and go at irregular intervals, and they often subside when you change positions or engage in light activity. Braxton Hicks contractions are usually irregular and don't get progressively stronger. They are more of an annoyance than anything else, and they don't indicate that labor is imminent. It's important to stay hydrated and rest when you feel them coming on. True labor contractions, however, are the real deal. These contractions signal that your body is starting the process of labor and that your baby is on the way. Unlike Braxton Hicks, true labor contractions will not go away with movement or hydration. These contractions indicate that your body is starting the process of labor. They are a sign that your cervix is beginning to dilate and efface, which means it is thinning out and opening up to allow your baby to pass through the birth canal. True labor contractions are usually more intense and regular. They will start off feeling like menstrual cramps and gradually become more painful and frequent. You might also feel them radiating from your lower back to the front of your abdomen. They will gradually become closer together, last longer, and feel stronger over time. This pattern is a key indicator that you are in true labor. Timing your contractions can help you determine when it's time to head to the hospital or birthing center. It's important to differentiate between Braxton Hicks and true labor contractions. Knowing the difference can help you avoid unnecessary trips to the hospital and give you peace of mind as you approach your due date. If you're unsure, it's always best to contact your healthcare provider for guidance. They can help you determine whether you're experiencing Braxton Hicks or true labor contractions and advise you on the next steps to take. Remember, it's always better to be safe and get professional advice. Your body will give you clear signals that labor is approaching. These signs can vary from woman to woman, but there are some common indicators that you can look out for. Understanding these signs can help you prepare mentally and physically for the arrival of your baby. One of the signs is the bloody show. This is a small amount of blood-tinged mucus that is released from the cervix. It can be a bit alarming to see, but it's a normal part of the process. This passage of mucus is a sign that your cervix is beginning to dilate and efface, which means it's getting ready for labor. The bloody show can happen a few days or even a few hours before labor begins, so it's a good idea to keep an eye out for it. Timing can vary greatly, so don't be alarmed if you notice it and labor doesn't start immediately. It's just one of the many ways your body is preparing for the big event. Another sign is the nesting instinct. This is a sudden burst of energy and the urge to clean and organize your home. You might find yourself arranging baby clothes, setting up the nursery, or even deep cleaning the house. This instinct is your body's way of preparing for the baby's arrival. It's a natural response and can be quite helpful in getting everything ready for your new addition. Embrace this energy surge and use it to your advantage. However, remember to take breaks and not overexert yourself. Your body needs to conserve energy for labor. Water breaking is another clear sign of labor. This is the rupture of the amniotic sac, releasing a gush or trickle of fluid. It can happen suddenly and might catch you off guard. When your water breaks, it's important to note the color and odor of the fluid. Clear and odorless fluid is normal, but if you notice any green or brown color, contact your healthcare provider immediately, as it could indicate meconium, which is the baby's first stool. If you experience your water breaking, contact your healthcare provider immediately. They will guide you on the next steps and when to head to the hospital or birthing center. Other signs of labor include back pain, diarrhea, and increased pressure in your pelvis. These symptoms can be uncomfortable, but they are all part of your body getting ready for labor. Every woman's experience is different, so it's important to be aware of your body's signals. Trust your instincts and don't hesitate to reach out to your healthcare provider if you have any concerns or questions. Being informed and prepared can make the labor process smoother and less stressful. Trust your instincts and contact your doctor or midwife if you have any concerns. If your contractions are regular, getting stronger, and occurring every 5 minutes for at least an hour, it's time to call your provider. You should also contact your provider immediately if you experience heavy bleeding, a decrease in fetal movement, or severe headaches. It's always better to be safe than sorry. Remember, your healthcare provider is there to guide you through this process and address any concerns you may have. By now, you've likely created a birth plan outlining your preferences for labor and delivery. This plan includes your choices for pain management, delivery positions, and who you want present during labor. Review your birth plan with your partner or support person. Ensure everyone is on the same page and understands your wishes. Keep in mind that labor is unpredictable and flexibility is key. Your healthcare team will work with you to adapt your plan as needed. Section 6. Riding the Waves, Pain Management Options. Labor is an intense experience and pain management is a personal choice. Discuss your options with your healthcare provider to determine what's best for you. Some women opt for natural pain relief methods like breathing techniques, massage, and hydrotherapy. Others prefer medical interventions such as epidurals or nitrous oxide. Remember, there's no right or wrong choice when it comes to pain management during labor. The most important thing is to feel comfortable and supported throughout the process. Section 7. Emotional well-being. Embracing the journey. Pregnancy and childbirth are not just physical experiences, they're deeply emotional too. It's completely normal to feel a mix of excitement, anxiety, and even fear as your due date approaches. Talk to your partner, loved ones, or a therapist about your feelings. Connecting with others who understand what you're going through can provide invaluable support. Practice relaxation techniques like deep breathing, meditation, or prenatal yoga to manage stress and promote emotional well-being. Section 8. Practical preparations, safety and support. As you prepare for your baby's arrival, there are a few practical things to take care of. Install and properly secure a car seat in your vehicle. This is crucial for ensuring your baby's safety during car rides. Stock up on essentials like diapers, wipes, and baby clothes. Having everything ready in advance will make the transition to parenthood smoother. Enlist the support of your partner, family, and friends. Delegate tasks, and don't be afraid to ask for help when you need it. Section 9. Embracing the final countdown. The final weeks of pregnancy are a time of great anticipation and excitement. Your body has worked tirelessly to grow and nurture your little one, and soon you'll hold them in your arms. Embrace these last moments of quiet bonding with your baby. Rest as much as you can. Nourish your body with healthy foods. Prepare your mind and heart for the incredible journey of motherhood. Remember, you are strong, capable, and supported. Trust in your body, your baby, and your healthcare team. The adventure of a lifetime awaits you.